afternoon. Thank you. Okay. These are my disclosures. So I'm not going to spend too long on the hepatitis B background. I think hearing from this session this morning, we understand the burden that we face for HBV, specifically in Africa, and how over 64 million people are living with HBV. And so it's really critical that we continue to monitor progress in vaccination, diagnose, and treatment to inform the policy so we can achieve elimination goals. So for this brief analysis, we took provisional data from our national hepatitis elimination profiles. We currently have 6, and many of the room have helped us develop those. Then we took data from WHO's Global Health Observatory and the WHO and the UNICEF Joint Immunization Forum for representation of 54 countries according to the African Union. And then we classified them into the regions according to the AU as well. And so we just did a descriptive analysis just to see where we are when it comes to the progress of the 2025 targets. And then we additionally wanted to see if any of these countries have met the path to elimination, or PTE, and as well overall, and also for elimination to mother-to-child transmission. And so we looked at the median values for these countries. All the dark purple countries are the countries that were included into this analysis. And so we found that it was pretty good that 83% of the countries had a median of, for their Hep B birth dose, but unfortunately, majority of the countries, we did not have birth dose data that was provided. So we had a median about 71% for 18 countries. And then the prevalence for children under 5 was about 1.8. That was 52 countries that we were able to get data from. And then unfortunately, looking at the diagnosis and treatment data, it was significantly low at 2.5% and a 7%. So when we looked at the regional data, kind of looking at this Hep B birth dose again, a lot of countries did not report data. So Central Africa and East Africa were the lowest reporting countries with data. But alarmingly, looking at the percent diagnosed and then the treatment for the percent of diagnosed, it's alarmingly low for all the regions. Moving into the 2025 target results, so 10 of the countries out of this analysis have met the WHO 2025 for Hep B birth dose, and that was set for 50%. And then 19 countries have met the 2025 and 2030 target for Hep B birth dose at 90%. Again, looking at the diagnosis and treatment, Rwanda was the only country that we have that have met that coverage target. And then Madagascar is the only country that has met the treatment coverage target as well. Again, those were fairly low. I believe in the highest, the top 3 that we had for treatment was Madagascar, Egypt, and Kenya. And so when we looked at the overall PT tiers, these are the tiers that WHO has set. No country has met the bronze tier at all for elimination. However, looking at mother-to-child transmission, some countries have. Again, this is based on Hep B birth dose and 3 dose. We did not have antenatal coverage available, and keep in mind that this has to be a formal PTE validation to be conducted by WHO. But as far as the bronze tier, we had 2 countries to meet that tier, 4 countries for the silver tier, and 3 countries for the gold tier. And so what is that telling us as far as conclusions? So looking at the 3rd dose, that's an achievement, and I think it sets a foundation and a stage of what we can do for birth dose as well, and when it comes to establishing elimination programs. But we also saw the persistent gaps in birth dose, in diagnosis, and treatment coverage. And as mentioned earlier, really bringing that Gavi support to introduce Hep B birth dose is essential. And then also looking at these regional differences and how we can come together and make progress. And so our recommendations for our next steps, as far as our 6 NHEPs that we currently have, we want to continue to integrate testing and treatment to track their progress. Examples of that is integrating into HIV, TB, maternal health programs that we could scale up diagnosis and treatment. We also want to urgently scale up birth dose, again, as we as a coalition can provide as much technical assistance as possible, introducing Gavi to support to those countries that didn't have the policy or lacking the data, as well as looking at countries who have been successful in implementing these programs and what lessons that we can take to implement them into those countries. And then something that is very critical, as we all know, is we need better data to fill in these gaps, prevalence data. We need to start standardizing some of the data collections and the systems that we have so that we're effectively tracking elimination. And then, I don't know if I should say this, but we want to make as many African and Hep profiles as possible. So if you are interested in making a profile, please come see me. And thank you.